Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm an inventor of ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headache, pain and fatigue before I invented ASTR. Okay, Christine, tell me what's going on with your foot. What happened?
It hurts. It hurts at night. It hurts when I do sport, and it hurts when I walk too much.
When you walk too much. So how long this been going on?
For 2 years now.
For 2 years. What they diagnose you with?
Morton.
Morton neuroma?
Yeah.
Okay. For the last 2 years, what kind of treatment did you have?
Some medicine and an injection.
Injection? What kind of injection?
Cortisone.
Cortisone injection. Have you had massage, physical therapy, or acupuncture?
Acupuncture. Yeah.
Okay. So what are you currently experiencing now? How much pain from 0 to 10 and what kind of pain do you experience?
So constantly from it's 7 and at night sometimes it's 10 out of 10.
So constantly you feel 7 out of
Yes.
10 pain?
Yeah.
Okay. And at night it's increased?
Yes. And I can't wear shoes.
Okay.
I feel at ease when I am barefoot, and
it's better with barefoot, or
yes,
okay,
a lot better.
Okay, all right. And how do you describe the symptoms? Is it sharp, dull, aching, stabbing?
It's sharp and burning.
Sharp and burning. Okay, so is this where you feel the pain?
Yeah.
You feel it between this?
Here.
Yes. That's correct. Or here?
It's here.
So it's tender to touch, yeah? Okay, sorry. Right in here, yeah?
Yeah.
Sorry, okay. Did you have any injury or anything, or just it's happened like randomly?
Randomly.
Did you have any fall or anything?
No.
Do you wear high heels?
I used to, but not a lot.
Yeah, I want you to avoid high heels. And make sure your shoes is not tight here.
Yeah.
Because that will cause a lot of issues here. You know?
I had tight shoes.
Yes. Yes, that will cause Morton neuroma. So I'm jumping to the inflammation now protocol to see how bad is your inflammation. Okay? So definitely in this spot you have inflammation. How does it feel?
Okay.
Okay. Well, what about now? Is it painful or it's okay?
It's okay.
Okay. You see, you could not tolerate that before.
Yeah.
Yeah, I could not even touch it.
There's a change now.
Yeah, so definitely inflammation went down after using the Magna Heal. There is no scar tissue here. You feel how nice and smooth in this area compared to this?
Yeah.
That's a scar tissue.
Okay.
So you have a lot of knots in there, in this area. Okay. And that would limit the range of motion and sometimes compress on nerve and artery. And especially here, when you have a scar tissue and inflammation on the nerve, that causes Morton neuroma.
Okay.
Because it compresses on the nerve in that area. 0 to 10, how much?
I don't feel pain.
Okay. Alright, so we'll have you walk. We'll have you walk and tell me how that feels with the walking. How is that?
It's better. I feel something, but it's just light.
Okay. Do you feel pain or just do you feel pressure?
Pressure, not
pressure.
pain.
Yeah, you're going to continue feeling the pressure because you still have a scar tissue. So it's going to take us time to really clear up everything. What I care about is the pain.
No, there is no pain now.
Okay. So, and you experience pain also, actually, we aggravate it with heel raises. So I want you to do a couple of heel raises and tell me how that feel.
I can do it.
How's that? Look at that. So you had Morton neuromas for how long now?
Oh, gosh.
2 years, yeah? Is it worth the flight to California?
That's sure.
Yeah.
I will stay in California.
All right, welcome.
Oh, that's nice.
Yeah, any pain, discomfort?
No.
All right, so what do you think about ASTR treatment?
Yeah, that's a miracle.
All right, awesome, thank you. All right, Christine, tell me give me update now. Today is your last day here.
Yes.
You had total of 2 treatment for your Morton's neuroma. So give me update how you feel and what do you think about the treatment?
I really do feel better, and I had no pain for 2 days until last evening for 2 minutes. So now I do feel better. I can wear shoes and I can walk, and there is no pain.
You could not wear shoes before you coming here for ASTR treatment?
Yes.
Okay, so you just had 1 episode for 2 minutes and that's it.
Exactly.
That's beautiful.
Yes.
And let's go back to your original symptoms. You had, how long you had the Morton neuromas?
For 2 years,
For
nearly
2
2 years, yes. And for 7 months I couldn't wear shoes anymore.
For 7 months you could not wear shoes, and you start to wear shoes after how long when we start working on it?
Just after, when I left here after the first treatment.
First treatment you were you're able to wear shoes after
and to walk,
and to walk with the shoes.
Exactly.
And you have a shoes now, so we'll have you walk with it. So before I treat you, how much pain you used to experience, and is it constant or it comes and goes?
Before it was terrible, because it was I could say 8, 9 or 10 out of 10. I fainted twice with the pain.
Sorry. Yeah.
I had to go to the urgency because it was too painful. And
emergency room, you mean?
Yeah.
Yeah.
And now it's I just don't feel any pain at all.
All right, awesome. So we'll have you walk with the shoes back and forth just to show us how you walk.
Of course.
Yeah. How was that?
That's good. Very good.
Yeah,
Nice.
that's awesome. You can have a seat there. All right. So, what would you say to a patient about Morton's neuroma and ASTR treatment?
I would say you just have to try and to do it, just to realize, because when people say it's good, unless we try, we don't know what it is.
Yeah.
But just do it. I recommend it. That's sure.
Awesome.
It changed my life.
Awesome. Thank you so much.
Thank you.
Feel free to subscribe to my channel to get helpful tips on how to relieve pain and watch real treatment videos. There are over 45 studies that support ASTR treatment model. If you are a patient and would like to schedule an appointment or treat yourself at home, check the link below. If you are a healthcare provider and would like to receive ASTR training and buy ASTR instrument, check the link below. See you soon!